Attention deficit and hyperactivity disorder, or ADHD, is the most commonly diagnosed neurodevelopmental condition in children and commonly co-occurs with many neurologic, developmental, and behavioral disorders. The prevalence of ADHD in the United States is estimated to be between 10 to 12% in children and adolescents ages 17 and younger. The primary objectives of this study were to 1, evaluate patterns of co-occurrence of ADHD with other conditions, and 2, examine treatment differences associated with co-occurring conditions. Data from the National Survey on Children's Health from the years 2017 to 2019 were analyzed for this study. The sample population was comprised of nearly 92,000 children ages 4 to 17 years old living within the United States. Of those children, 9,988 were reported to have a current diagnosis of ADHD, a prevalence of approximately 11% in the general population. Of those children, 7,506 were reported to have at least one co-occurring condition. Co-occurring conditions were further examined in quantitative subgroups with 0 co-occurring conditions, 1, 2 to 3, and 4 or more co-occurring conditions, as well as qualitatively with behavioral, neurologic, and developmental co-occurring condition subgroups. Treatment patterns for these subgroups were compared, and chi-squared values were calculated to help determine statistical significance. Anxiety and behavioral problems were the most common reported co-occurring conditions, while neurologic conditions like epilepsy, brain injury, and cerebral palsy were less common. Treatment methods were statistically different depending on the type of co-occurring condition, with a p-value of 0.0282. Children with behavioral conditions and no co-occurring conditions were most likely to be treated with medication therapy alone, with 30% of children in these subgroups reporting only medication therapy. Children with any type of co-occurring condition were more likely to be managed with combination medication and behavioral therapy, with 30 to 40% of children in these subgroups reporting co-management. Children with no co-occurring conditions were the most likely to receive no treatment. Treatment methods were also statistically different depending on the number of co-occurring conditions, with a p-value of less than 0.001. Children with 0 or 1 co-occurring conditions were most likely to receive medication therapy alone, with 31 to 35% of children in these groups reporting medication use only. Children with more co-occurring conditions, 2 to 3 or 4 or more, were more likely to receive combination therapy. Children with no co-occurring conditions or children with 4 or greater co-occurring conditions were most likely to receive no treatment, either medication or behavioral therapy. In conclusion, most children with ADHD and co-occurring conditions seem to be receiving combination medication and behavioral therapy. However, it is concerning that 20 to 30% of children with co-occurring conditions in ADHD are not receiving any form of treatment. Limitations of this study include small n values for some subgroups, particularly the neurologic disorders, as well as the nature of parent reporting, especially considering the overlapping nature of ADHD, some of these co-occurring conditions, and their symptoms. In conclusion, most children with ADHD and co-occurring conditions are receiving guidelines-based care. However, approximately 20% are not receiving any form of treatment, and management remains variable across subgroups.